We've got a board certified plastic surgeon on with us right here, Dr. Norman Rowe from Rowe Plastic Surgery. You are on the Upper East Side. You are in the Hamptons. You are in Florida. You are where all the big money is. Dr. Rowe, thanks for being with us.
Thank you for having me. I really appreciate it.
Yeah, so it's great. You know, it's interesting. The pitch I got from you guys, which did speak to me, is, of course, a lot of these sort of trends in plastic surgery are being driven by the fact that we've got our phone in our face. Maybe we're Zooming for work. We're sending selfies. We're trying to be social media personalities. And really, these days, we're just getting a look at ourselves close up in a way that even 10 years ago probably would have been inconceivable. And that naturally leads us to want to do a little things, a little tweak here and there to be the best version of ourselves. And, you know, one of the big surgeries I know that's really popular now is getting your eyes done. So you've got the upper and lower bleph. 2 years ago, I got my lower eyes done. I had baggy eyes. It drove me nuts. I went back and forth. I didn't know if I should do it. I'm so thrilled I did. So basically walk us through what the upper bleph and the lower bleph are and why they're so popular right now.
Of course, sure. That my pleasure. Well, what a blepharoplasty surgery is, upper lid and lower lid blepharoplasty is, as we age, a lot of times we'll get excess skin, and that's just life. And also, in addition to excess skin, there's fat around the eyeball, and it helps keep the eyeball protected and what have you. Over time, the skin loosens up, sags, and then the fat slides forward, and we get the pouchiness, and that's two of the things that we need to usually address when we do a blepharoplasty surgery. And what you do, you resect, or you cut out a little bit of extra skin, or you can laser the extra skin to tighten it up, and you remove the fat pockets. Now, 20 plus years ago, when I first started, you know, the dictum was you remove every last bit of fat in the eyelids, and that was considered aesthetically pleasing. Now we're taking less and less fat because it's not about removing fat and hollowing out people and giving them that skeleton look. It's about repositioning the fat to where it was, you know, 20 years ago or 15 years ago. So the techniques have changed, and they are, you know, very, very popular. As you mentioned, blepharoplasty surgery is very popular. And honestly, I think, to hit on that, I think one of the reasons why is you get a lot of bang for the buck.
Yeah.
The downtime is, you know, it's a quick recovery, and you get dramatic results. A lot of patients say, well, can I laser? Can I do Botox? Can I do filler? You can, but by the time you do all those procedures, you've kind of spent, at least financially, similar to what you'd spend for a blepharoplasty surgery. And your downtime is going to be less than or almost the same as lasering. So that you get a lot of bang for the buck. And I think that is why people are doing it more and more, and why it's a very popular procedure now.
Yeah, no, totally. I agree. So I get the lower bleph. And I mean, with that, you just go inside. I never felt a thing. Obviously, they put me down for the surgery. Afterwards, you're a little bit banged up. So I just, had the week off from work or whatever. But, certainly I didn't have any problems afterwards. The results were immediate. They sort of tightened things up. And then the upper bleph, which I did not get done. But that's when you make that incision up here in the fold.
Make an incision in the upper lid and remove. In both procedures, in one way or another, you need to remove the excess skin and the excess fat, or reposition the fat. But as I said, the recovery is quick, and in most instances, as opposed to other types of surgeries where you have to use general anesthesia and put the patient to sleep, blepharoplasty surgery you can do under local anesthesia, which is the same thing that you get when you get a tooth pulled.
Yeah. So what's the breakdown of male, female as far as people getting their eyes done these days?
Across the country, women still far outpace men as far as getting eyes done. It's probably on the order of about 80 to 20%. There are certain geo areas where the number of men who are getting procedures done is slightly higher. New York, LA, and Miami being one of those. But the more common procedures for a female, kind of talking about procedures in general, are facelifts and rhinoplasties. For men, it's neck lifts and blepharoplasty and liposuction. Those are very popular. But as far as blepharoplasties go, it's about 4 to 1.
Female to male. Yeah, that makes sense. And the facelift trend is we're seeing that used to be sort of like, in my mind at least, 60s, 70-year-old people. Now it's a much younger person coming into the surgeon's office looking into that. Walk us through sort of the pros and cons of what you think about that trend in general.
I think it's reflective of a trend that overall is very positive. What that tells me, or what I see, is people are starting to take care of themselves and think about their looks and think about aging at a much younger age.
Mm-hmm.
Years ago, 20, 30 years ago, women, as you said, in their 50s, 60s, 70s, would go down to Miami for a vacation. They'd come back a little higher and a little tighter.
Mm-hmm.
Women now, women and men now are starting to take care of themselves a little bit earlier, and they don't wait to the very end when they need a dramatic tight facelift, because they never really addressed it until they're 60 years old. When people start at a younger age with non-invasive stuff, lasers and Botox in their 30s, 20s even, then, and they say, well, I kind of need a facelift or want a facelift when I'm in my 40s. That's okay. And the reason why, not all facelifts are created equal. When you're in your 40s, you might not need as aggressive a facelift as you do if you did nothing and you waited till you were 60. So the thought process is you do a little bit when you're younger as opposed to doing a heck of a lot when you're older.
Right.
So in that regards, what do I think about it? I think it makes sound medical sense.
What percentage are there people who come in asking for things and you just say, you know what, I don't think you need it. I think you're too young. I think this is too aggressive. Are there any people you sort of turn away and just say, I don't think this is a great idea for you?
Absolutely. That's a great question. And the answer to that is, of course. If someone has if I, as a surgeon, as a plastic surgeon, I have to see a problem in order to correct it. And if I don't see it, there's no way I can correct it. And if I don't think, in my professional opinion, not personal, but my professional opinion, that someone does not need that procedure, I won't offer it to them despite what they say. And I think any plastic surgeon, worth his weight would will do the same thing. I mean, you try to give the patient what they want within reason and lead them to a conclusion that you think is sound medically, and move ahead. But if someone wants something that I just think is, they don't need, or, they saw, it's a whim, then I'll, my response to that is, you know what, let me think about it, and I'll give you a call back. And we usually don't call back.
Right. Yeah. Hopefully they don't just keep going to doctor until they get someone who does it.
Well, that's true. That's a strong point. And I tell this to patients: you keep doctor shopping, you'll find some guy who'll do it, and you're not going to be happy.
Yeah, I mean, we've seen those shows too. I forget that.
Right.
Dr. DeBro, where he's going to go botched, where they go in and fix all the stuff, of course, afterwards. Right. It's fascinating stuff. Yeah.
Yeah, and that's actually a good point. I mean, as far as fixing something. Well, I'll tell you what, it's much, much, much easier to create the problem than to fix it. So think long and hard before you get something. Go to someone who knows what they're doing, comfortable. And if a doctor says you don't need it, you don't need it. Because if you do get it and you found out it's a mistake and you want to reverse it, much more difficult / impossible to fix a problem after you've created it.
Much bigger issue. Dr. Norman Rowe, we appreciate your time. We know you are always busy. It's fascinating stuff, though. It's definitely in the conversation these days, now that we're all hooked on social media, trying to speculate on who got what done and all that sort of stuff. And, of course, the less people can tell, the better. So less is more. I think that's probably the way to end it on that.
Absolutely.
We appreciate it. All right, Dr. Norman Rowe from Rowe Plastic Surgery. You're in New York, Florida, elsewhere. You can find him online. We appreciate it. Thanks so much.